a child age 2, 2.5, 3, 3.5, 4 to be tagged as autistic, and then we need to do something for that child. And unluckily, the worst part of it is that once a child is tagged as being autistic child, the child is now sent to special education centers. The child is now sent to psychotherapists for OT, for speech therapy. And even if a child could have easily come out of that phase, going to those artificial setups, looking around and having so many other kids who are autistic, who are making blabbering sounds, jargon words they are using, the chances of a child quickly improving and coming out of that autism further go down. So that is why it is very important for you as a parent to understand that if a child is not verbal and is not verbal at a very tender age, rather than waiting for someone to tag that child as being autistic, it becomes so important to work in the right direction and ensure that the child comes out of that phase. So that is why using the herbs which can improve the speech of a child are so important. I'll be coming to all of your questions. Your questions are really very important for me and for us. And your names are there, your questions are there. And once I complete the topic, which is very important topic for us today, I'll immediately be coming back to your questions. So moving ahead. Now, once a child crosses 4.5 years of age, now what happens? Now a child crosses 4.5 years of age. Now this is the approximate age, which is the age of reflex language development age going away. Once a child crosses 4.5 years, now the reflex language development which was to occur in the child, now that age has gradually gone away. And now it is the age where a child can be trained for a language. And that is why when our children go to schools at this age, at a particular age, they are introduced other languages. The teachers, they teach them those languages, and yes, the child is trainable for those languages at that age. But if we say that a reflex language development is going to occur at this age, no, that age is lost. That is why when a parent comes to us after the age of 4.5 years, and now the child is non-verbal or is using very less words, it becomes very important now to make the child focus, because many a times by this age the children, they will become hyperactive, they will lose focus, they will not concentrate. So that is why when a child above 4.5 years of age comes to us for a language development, what I always tell the parents over there is that, see, we will firstly have to work on hyperactivity if the child is hyperactive. We will have to work on the concentration span if the concentration span is low. We will have to work on the command following if the command following is low. So those are the things which firstly need to be addressed, as in most of the kids those problems have gradually developed with the growing age and without usage of language in that particular child. So that's why the right herbs which we use after 4.5 years are generally the herbs which are there in Breno R. So let me show those herbs to you. And when I talk about those herbs, as you can see on your screen, Mandukparni is one of them, Kushman is one of them, Ashwagandha is one of them, Amalki is one of them, Jatamansi is one of them, Sarpagandha is one of them, Ustakadus is one of them. And as you can see, these herbs are almost entirely different from the herbs which were being used below the age of 4.5 years.
Autism is a temporary phase in the life of a child if treated timely.
This is the case study of Parth, a 3-year-old child diagnosed with autism. At a very young age, Parth showed multiple developmental challenges. Chief complaints: speech delay, hyperactivity, irritative behavior, less interaction, poor understanding. Parth's detailed medical history was documented and evaluated before initiating treatment. In April 2023, Parth's parents consulted Dr. Navdeep Sharma and felt confident about the scope of treatment. A personalized Ayurvedic treatment approach was planned using specific herbal formulations to support neurological development. Braino R Plus, supporting attention and neurological response. Braino R enriched with Mandukparni, Kushmand, Ashwagandha, Amlaki, Jatamansi, Sarpagandha, and Ustaculus. Braino A Plus, supporting calmness and behavioral balance. Braino A enriched with Shankpushpi, Brahmi, Shatavari, Bringraj, Shunti, and Vacha. Cucurbita oil, supporting nourishment and neurological health. Mukta Pishti, supporting mental stability and reduce irritation. Before treatment, Parth often showed irritative behavior and did not respond clearly to instructions.
करो
आ जाएगा वो.
Within 9 months of undergoing treatment from Dr. Navdeep Sharma, Parth showed significant improvement.
कलर करो. वेरी गुड पार्थ. कलर करो. नो, इस हैंड से करते हैं. इस हैंड से, राइट हैंड. वेरी गुड. इसके अंदर रख दो. वेरी गुड. पापा का हैंड, दीदी का हैंड पकड़ो. वेरी गुड पार्थ. चलो. वेरी गुड. खाओ. वेरी गुड. पार्थ तो बहुत कम.
Hello parents, Parth, say hello, say hello. This is Parth, my son, he's about to turn 4 years old. Last year in July we went to Dr. Navdeep Sharma sir. A sir had told me about him. We never imagined that in just 9 months Parth would start saying mama and papa to us so soon. As a mother, as parents, we always longed for the day when we would hear Parth say mama and papa. Today Parth says mama, papa and everything else with understanding. By God's grace and with Sir's medicine and guidance, in just 9 months, Parth is now living a near normal life. And Parth was also in playgroup at school. Just 15 days ago, the teacher at school said that Parth will be moved to nursery, and the happiness that Sir has brought into our lives, what more could parents ask for than to see their child improve so quickly and so well? For parents, this is truly a big thing. Thank you, Sir. Thank you very much for bringing such great happiness into our lives. Thank you, Indian Roga.
Call now to connect with Dr.